Welcome back. Staying with our cancer focus, we have radio personality and journalist Xolani Gwala and Health Minister Dr. Aaron Motsoaledi. Dr. Motsoaledi, let's come back with you and maybe paint a picture of how many oncologists we actually have. Are we capacitated enough to deal with the public healthcare system in terms of oncologists?
We're not. We definitely are not, because whether you speak of oncology or any other specialty, the abnormal situation in South Africa is that 80% of all the specialists of whatever type will be found in the private sector, saving only 16% of the population. And the public sector, with 84% of the population, will remain with 20% of the specialists. So if you look at the NHI document we've released, our aim is whatever number of specialists we have got in the country, they must be available to both the public and the private at the same time, which means they must be available to the rich and the poor at the same time, which situation is not pertaining now in South Africa.
Let's just take a caller. Wandile Zulu is on the line from Johannesburg. Wandile, your question or comment?
Is directed to the minister. First of all, the minister should just focus on South Africa and not tell us that something is global. And then secondly, when are we going to have government ministers, civil servants, all of them going to public hospitals? Because the problems we are facing is because we've got two worlds of the political elite going to private hospitals, as well as the poor South Africans going to public hospitals. I think we can solve this problem if everybody, including the minister, the president, the MPs, going to public hospitals. Now, they talk from a distance, and they're not affected by what is affecting the millions of South Africans. When are we going to have a situation where all South Africans, because we paid for them to go to public hospitals?
Thank you very much, Wandile Zulu, for
the
question. Dr. Motsoaledi, a lot of South Africans, some feeling that perhaps this is what should be happening. Your response to that?
It's a brilliant question by Wandile, and his depth of understanding. For instance, he says we are paying for the elites to go to the private care. And it's a wonderful statement because I've been harping on it and people rejecting it. For instance, in the past 3 years, the private public health sector lost 9 billion rand. But the private health care got 11 billion from the same fiscus, which is a public fiscus. The private health care was subsidized for 11 billion, whereas the public health care lost 9 billion when it's already struggling. You can connect those figures. Now, the issue of ministers and all that, by the way, I've already started. I've done that. It's on record.
So you don't have medical aid?
I do have, but I go to public hospitals. And even then, people condemned it. The last time I was admitted in Steve Biko, all over the social media, they were saying I'm pretending, I'm just lying there, but being treated by private doctors. It took the dean, the then dean of the medical school, Professor Eric Boo, to respond publicly and say, no, that's not true. This man is here, he's been treated by us and all that, you know. And it's not that private hospitals are totally useless on this. For instance, on prostate cancer, Steve Biko is #1 in the country. Even private hospitals refer there for prostate cancer.
Which means it's overburdened. We need to
Well, the skill. There's only one professor in the whole country who have got that skill. That's what they are looking for.
That's scary.
Yes, it's only one, and in both the public and private, and so they've got to refer there. I'm just trying to show you that there are certain things they also do better. But where I agree with Wandile is that everybody must use all the facilities together, and so I'm amending what he said when he said everybody must go to public hospitals. I'm saying everybody must be able to go to whichever hospital is able to offer that function at that point in time. And that's what our NHI bill is saying. We want South Africans to have access to public and private hospitals, depending on the circumstances, depending where you are. For instance, at the moment, the elite like myself and all the people who are on medical aid, who form only 16% of the population, can use both sides, by the way. They go to the private sector. When their money is finished, they are thrown back to the public sector, all of them, and where they must be served. Whereas if you are poor, you go to a private hospital. If it is full, even if there's a private hospital next door, you know, which has got that service, you can't go because we have got no way of using that service. And that's why we want to cancel this issue of one side using one set of one system, and the majority using a different system.
Well, let me bring you.
No, you know, my understanding of Fondi is that he says if the ministers, president, MPs went to public hospitals, the management will improve, and they will improve. Because, Minister, if you say everybody must go, you know, it's a different case when you're in a ward and a specialist comes to you and says you have stage 4 cancer. You want the best. You don't want to take chances. Now, if you say everybody must go.
Everybody must go where?
If you say everybody must go to the public hospital, I'm saying you must understand that at that particular point, all I want the best possible because it's risky.
Yes, but that's one dealer who says everybody must go to public.
Yes, but what he's saying is that let's start with leadership because if all the ministers went,
I agree with him, and I've already started, by the way.
And I accept.
I've already started doing that.
And
now,
it must be law, and I agree with him because
no, the law cannot say that. The law, which is under NHI, is saying we need to open all facilities to all South Africans, whether public or private. Not to say everybody must go to public hospitals, meaning the private ones. What must happen to them? It means with all the facilities.
Dr. Motsoaledi, you've started, and to what Wandile was saying, you know, if you guys go to public hospitals, and Golana's point as well, that perhaps there could be something done better. You saying when you have started?
I agree with that wholeheartedly,
100%.
and I'm encouraging my colleagues to do that.
But what seems to be the resistance?
Sorry?
What seems to be the resistance?
Well, the resistance is that at the moment, as I'm saying, the only legislation that is there is the Medical Schemes Act, whereby people are very high, are on medical aid, they are subsidized. They believe they have to use the private health care, and nothing forces them to go to public health care unless they run out of money. So in order to compel them, you make a law, and that's what NHI bill is doing, that all health facilities that exist in the country must be used by all and sundry. If you are in Bentley, you don't say, no, let me go to Durban to use private health care. You go to Bentley. You must find services there. But if Bentley cannot provide you that services, and there's a private hospital somewhere near which can, then you ought to be able to go regardless of your socioeconomic status. As NHI is saying, at the moment, people are divided through socioeconomic status in South Africa because there's no law that cancels that. And the NHI bill is going to.
Showing good faith like you are doing and leading an example, it will give some people a sense of comfort to see their public officials actually see what they go through as well.
Precisely, and let me tell you, can I tell you one thing? I've repeated it in many meetings, and though one day say I must not wander around the whole world, I have to. In the World Health Organization Africa region, I've mentioned 4 times already that unless heads of states here on the African continent stop going to Europe or the Far East or America when they are sick, they must be treated here at home. I've repeated that, and I keep on repeating it. Because if heads of states keep on going to look for health care somewhere, it's true, they won't know what's happening back here at home. They must be with the masses and with everybody to understand, and they'll be able to improve. That one is also my campaign, so one day they can join me in that campaign.
Soraya Patel, calling us from Johannesburg. Good morning to you. Your comment or question?
And good morning to the panel there. Can you hear me?
Hi.
Good morning to the panel.
Morning, Soraya.
To Mr. Gwali, I take my head off for you. Being a cancer patient, I know what you've been going through. I'm sitting with my mom, an elderly lady. She had 11 strokes. She survived it. Then after that, we found out that she's got colon cancer. And then she had the operations done. We actually assist her, like you say, it must come also from family where they assist and stand together. We went through a lot. But on the other hand, she survived that as well. And today she's a woman of 74, still very much alive. And if you believe, you can conquer the world. Right?
Yeah.
But to the health minister, I want to say, sir, you need to make the government hospitals aware of treating patients with dignity in some respects, sir. Because I've seen how they treat elderly people in the hospitals, government hospitals I'm talking about. They don't treat the people so good is what we want to know, that it's fine, go for your treatments and all of that. It makes people despondent. So we need to sort that out, sir, and you need to make sure that government hospitals treat people, even if it's HIV or cancer. Let them have some respect, because these people are now dying. You know why? Because there's no dignity and respect for them. I thank you, sir.
Thank you very much, Surya Patel, for that comment. Xolani, you know, just going back to your journey and what she talks about just being there for her mother and seeing that and how that has actually strengthened their faith. We touched on a little bit earlier about what this has done for you.
Yeah, no, I completely agree with her. You know, there's nothing more than your family support. You desperately need it. That's when you need your family to be around you. To give you that mental support, that, you know, and then let doctors do the other part.
Yeah.
Yeah, definitely she's correct about it. And I think, by the way, she's correct about having to find a way of restoring a culture of caring, Minister. And I think that's what she's saying. Treating people with dignity, regardless of where they come from, regardless of their socio-economic status in society. I don't know how we do that, but we need to find a way of just, because even if you're going to die, but die with dignity.
Do you get
Absolutely.
these complaints, Dr. Motsoaledi, of people who are mistreating patients in public hospitals? And what is done about it?
Of course we do. We do. And if I take you far back in 2010, when we realized this problem, we commissioned 5 institutions to assess all our public health facilities, clinics and hospitals for 6 things which we call core standards. It was cleanliness of the facility. It was attitude of staff, which is what Soraya is talking about. Attitude of staff to patients. It was safety and security of patient and staff, long queues, you know, waiting times, drug stock outs, and infection control. And out of that data, we established an office of health standard compliance.
Yeah.
That must enforce this. But then I went further. I said, let's establish an UMBAT person's office. You know, the UMBAT, Professor Malga Purumahoba, who the public started knowing when he did Life is Demanding. They thought it's imposed from outside. It was ourselves. And people asked me, because he was South Africa's first ever UMBAT, they said, what is the health UMBAT? I said simply, it's a public protector of health, because the public protector's office was already well known. And I use that example and say, when you have got complaints, because up to before we established the Office of Health Standard Compliance and the UMBAT, it was only the Health Professions Council. If you are a health professional, like a doctor, a physiotherapist, you know, you get reported there only for ethical breach. Then there is a pharmacy council. Then there's a nursing council for nursing breaches. But I said, the healthcare system doesn't consist only of doctors, nurses, and pharmacists. It consists even of the night watch person at the gate, where some women say, I was returned by the night watch person, even before the health staff saw me, who chased me away and said, the clinic is closed. And we said all those, the Office of Health Standard Compliance must check and they must be reported to the UMBAT. So it's one big area, because when the results came due, there was 80% failure on the attitude of staff, unfortunately.
That is not shocking.
Yeah,
it is. It's distressing, and a lot needs to be done. We
need
to move beyond having policies.
It was. That's why we then started.
Let's take Cecilia Brits from Stellenbosch. Cecilia, good morning to you. Your comment or question?
Hello.
Hi, Cecilia. We can hear you. Go ahead. Your comment or question?
I just want to tell you, am I on the air now?
Yes, you are.
I just want to say, 31 years ago, I had cancer in my uterus. And the main thing I worked with was the stress. And also to get your diet right. to not eat any animal products then. I went to the hospital because I bled quite a bit and I had to get a blood transfusion. But I refused the operation and I refused chemo because chemo kills you. There is a lady in Hout Bay that has got a website, canceralive.net, and where she teaches you what to do. You can work with your stress because we make our own stress. And most of the people have a lot of stress these days. They're not even aware of it. But it's how we deal with it. And in South Africa, we've got this amazing herb called Sutherlandia that cures cancer. And also go on the internet and look it up, vitamin B17. They used to say that scurvy was a disease called scurvy, but it was a deficiency of vitamin C. So now with cancer, it's mostly a deficiency of vitamin B17. And like for instance, I had a client I'm a reflexologist, and I had a client who had prostate cancer, and he ate 5 apricot kernels which does have the vitamin B12 in it.
Cecilia, thank you so much for your comment, and you raise a very important point in terms of your diet. Polani, we'll get into that with you in a moment, but we do have Philip Mkhize from Mabopane also on the line for us. Philip, good morning to you. Your question or comment?
Good morning to the panel.
Hi.
Hi.
I'm just going to quickly pass by the minister's address in saying it is not as much as the long queue that affects the people who are waiting to be treated on a public hospital, as much as the lack of empathic care that Ubuntu that comes first. The people that serve us down there, you may come out as a leader with a good heart, with good intention, but down there as it filters down, the people who are public servants serving in our public hospitals, in our clinics, I have experience of that. I have lost both parents to cancer, both in 2013 and 2016 respectively. And my experience was, Abantu don't really care. And Abantu, they got a nonchalant approach towards taking care of the patient. But again, you are an inspiration to us all, to especially for coming out in the open and opening up about your diagnosis and then the simultaneous and all of that.
Thanks.
Thank you, Philip, and we do apologize to our viewers for that stressful sound, but we had to get that comment. On the spirit of Ubuntu, as other callers have called in and touched on, we'll get into that in a moment, Dr. Motsoaledi, but let's talk about diet. Cecilia raised a very important point. How has your diet changed?
So certainly it has changed after going through all of this, but it's actually quite interesting because she's talking about chemo, that she refused to take chemo, etc. And I think it goes back to, we have to have a protocol, Minister, about what is it that needs to be done, because it gets very confusing. And I'm going to be very brief. So when I made an announcement on 702 about my situation, I tell you, I got tons and tons of emails. Some of them saying only 3% of the people survive chemo. But chemo helped me because it shrunk the cancer that was in the liver and it changed it from inoperable to operable. So it does work for some people, it doesn't work for other people. I think the issue is to educate all of us that sometimes it works, sometimes it doesn't. It's not necessarily true that it doesn't. Diet is a critical part of it. Diet is just at the center of it. Now things have changed completely. I don't eat red meat anymore.
Do you miss it?
Not really, actually.
Are there things that you miss that you used to eat that you don't eat anymore?
No, I suppose you adapt quite quickly.
Yeah.
People, the body adapts quite quickly. No sugar, no meat, no those kind of things. Red meat.
And it's a necessity, so there's nothing that can be done with that.
But I think the issue for Minister is that we've got to find a way of then educating people about what happens. What is the next thing that you need to do once you find out that you have cancer?
Dr. Motsoaledi, before you answer that, let's just take one last caller and then we'll get into it. Zandile Zulu, good morning to you. Your comment or question?
Morning, how are you?
Well, how are you, Sisi?
I'm okay. Firstly, I would like to just say to Xolani, thank you so much for telling us your story. We are really encouraged.
Thank you.
And to the minister, I would like to agree with the minister. The health care system in South Africa is overwhelmed. The demand, I mean, we have people from all over Africa needing help from this country. So let's use the private health care. Let's use them. They must be forced to reduce their prices. Some people actually can afford, just that the prices are too much. You see. So now, I mean, why must the government be strained and invest so much money in training people where there are people available, there are, I mean, facilities available, they must be used because this is an emergency.
Zandile Zulu, thank you very much for your comment. And Dr. Motsoaledi, you find out you have cancer, what do you do?
Yeah. Firstly, let's not ignore what Zandile is saying. It's extremely important. We can't continue to live in a country where certain resources are put aside for certain group of people only. They've got to get used, and I'm emphasizing that because that's what Zandile is talking about. Secondly, before that, let me answer this question before we lose it, Xolani, about whether chemo works or not. Any medication for any disease, when you are treated anywhere in the world, either the medication is going to work or it's not. And doctors have to weigh. The problem with chemo is about side effects. But you'll remember that the same thing was said about HIV and AIDS. When the country went into denial about HIV and AIDS, the main issue put forward was side effects. But people were dying. And then we started treating people. There are 4 million people, 4.2 million now, on ARVs in South Africa, 200,000 in the private sector, 4 million in the public sector. Many of them are alive. You have seen the statistics. Life expectancy has risen. There are still side effects, but they've diminished. So imagine if we kept on clinging to side effects and how many people have died in South Africa, millions and millions. So even with cancer, there are side effects, but doctors weigh. They look at you, what stage of cancer are you, they look at age, they look at many factors, so they can't be one size fits all.
Right.
They decide.
Unfortunately, this is where we have to leave the conversation. Dr. Motsoaledi, thank you so much for coming through to talk to us. Xolani, thank you very much. And we're so happy that you are back in tip-top condition. Just before we let you guys go, maybe projects that you are working on briefly?
Well, we actually are talking with the Department of Health, and we're doing a couple of campaigns together.
Okay, great.
We will be launching in Pietermaritzburg at some point, Minister, the Cancer Month, and there are 1 or 2 other projects that we're working together on.
We'll be keenly keeping an eye on that. Thank you very much for coming through.
Thank you,
thank you.
And thank you for agreeing to help us. He's going to be one of our biggest ambassadors.
Us, right?
No, he's going to be one of the biggest ambassadors because you will help, but he will help in 2 ways. Being a TV journalist, a radio journalist, you know, people listen to him all the time, but being a person who went through it and understand it, you being the person who is interested in it. So when we combine you, all these problems we're having about people not knowing, especially in black communities, they come very late. No question about it.
We'll fight about other things. Let's guarantee.
Why do you want to emphasize on fighting?
Thank you very much to my guests for joining us, and thank you for staying with us this morning. And that's where we leave it. Have a fantastic Sunday afternoon. Bye-bye.